At last year's meeting, we asked you about your partnership with ICER, a non-profit group that is working to establish cost-effectiveness formulas that would ration care by cutting it off from the most vulnerable patients. In recent weeks, when the COVID-19 scare was at its height, public officials gave instructions and made plans for exactly such a triage at the expense of those communities. Will you announce to shareholders and the public today that you do not support such cost-effectiveness formulas and commit to ending funding for any organizations or programs that embrace such an approach? And let me answer that by saying that, look, as you think about the nature of our business, one of our overarching objectives and goals is how do we ensure, from a pharmaceutical perspective, how do we ensure that we're getting the right drug to the right patient at the lowest possible cost. And I think as we probably had talked last year, we've done I think we've done a terrific job in our PBM business in terms of bending that cost curve and challenging the dynamic that the pharmaceutical manufacturers have been able to raise prices time after time after time, and they really control the challenges that Americans across the country have had in terms of affording their prescription medications. And as a PBM, we have been able to make meaningful improvements in ensuring the affordability of medications. So we've got many examples to prove that out. To include our latest innovation, where those individuals that have diabetes, we, in working with our clients, have created a way where their members can have zero out-of-pocket costs, which certainly takes the entire question of the cost of medication off the table. So one of the dynamics that we deploy is, and this gets back to the work of our clinicians, that there are multiple therapies within a therapeutic class for a particular indication. And the world around us has said, look, from an outcomes perspective, we don't need all of those various therapies, and we, from the tools that I just described at a high level, we've been able to introduce cost as now a variable of care. And what's interesting is, when physicians, and we've been able to provide the physician visibility at the moment of truth, which we would define as the point of prescribing, when he or she is getting ready to write that prescription, we've been able to show them the member's out-of-pocket cost, and we found that they're switching a large percentage of the time, to a lower-cost therapy. That does not compromise the effectiveness or the clinical outcomes that that the physician, and we as patients are striving for. So we'll continue to deploy those tools in an effort to ensure that people are getting the members and the customers, the patients that we serve, are getting their needed medications at the lowest possible cost.